Surgeons who work with amputating limbs, what was your worst OF moment? When the blood was green. A rare disease caused by overdose of migraine medicine. So he wasn't a Vulcan? Not a surgeon but a leg amputee. I was reading the notes from my surgery and the doctor stripped the screws when trying to remove the titanium plate that was holding my leg together. He had to call in backup. You'd be surprised how easy it is for that to happen. When screws have been in place for a long period of time, the bone tends to grow into the grooves, making stripping the screws quite easy. We even have a broken screw set that we use to remove screws once they are stripped. The first surgery I saw as a nursing student was a toe removal. Poor patient had to have his big toe removed due to a diabetic ulcer that had gotten infected. I was so afraid of the thought of getting nauseous with my first surgery. I didn't eat breakfast that day. The case started at noon. I was wrapped in the sterile gown and mask, hair cover, shoe covers. I was positioned by the circulating nurse in a spot with a great view but wouldn't get in the way. The case started and the doc started cauterizing bleeding veins, capillaries right off the bat. I learned that cauterizing flesh smells a lot like searing steak. My empty stomach and hungry brain didn't know the difference. And I could hear my stomach growling at the smell. I thought it would be just my embarrassment. Until the surgeon and nurse both looked at me. They could hear it too. I'm not sure what I said. But I was glad my mask hid how I was struggling not to cry. It was awkward until the doc took the severed toe and tossed it over the patient and into the formalin container. He had great aim. I feel your pain. I was a nursing student watching a hysterectomy and the cauterization smelled like rotten McDonald's to me. Next thing I knew, I was on a stretcher with a nurse rocking my bent knees back and forth and rubbing my head. I knew right then the OR wasn't for me. Surgery resident here. The ODUC moment doesn't really happen in the OR, but can happen after. One consideration is always at what level do you need to amputate the toe. A transmetatarsal, BKA or ACA, below or above knee amputation. If you decide too much, some sicker or more elderly patients may never regain mobility again. If you choose too little, the disease process, infection or ischemia, might not be controlled or won't heal and you end up going back for more. The realization you have to go back for more is the moment. The 24 hours after a tough case are the worst. You're wondering, did you nail it or did you miss something somehow? Medical student, future orthopedic surgeon. On my vascular surgery rotation, we had a gentleman who initially came in after a left TMA, transmetatarsal amputation, where your toes are amputated, that wasn't healing and becoming infected. The next step after that was a BKA, below knee amputation, in an effort to both stop the infection from progressing higher up his leg and also be able to receive adequate blood flow to heal. That surgery was executed well, but unfortunately the day he was cleared to work with physical therapy, he fell on the other, right, knee, which created a hematoma that later became infected. About a month later, when I had transitioned from vascular to orthopedics, we performed a salvage aka above knee amputation on that leg. Our gentleman went from being able to walk with difficulty to losing both legs in the span of about 2 months. Damn. This one is awful. Poor guy. I want a real surgeon to come and tell a story about when they locked their keys in the car or something. So, surgeons of Reddit, when was the last time you struggled to empty the vacuum cleaner? I remove a lot of eyes when training. I had a nasty one that I just couldn't grip with forceps while I was making the main cut in the optic nerve. I had to resort to gripping it with my fingers. As you are imagining, I made the cut. It shot through my fingers like a grape, hit me in the chest, rolled down my gown, bounced off my foot and rolled about 10 feet on the floor, leaving a bloody snail trail. It was a lunch break change, so about 10 people were in the room switching over. I headed upstairs when I was done to join my preceptor in another case. He sees me walk in, sees a bloody spot on my shoe cover and asks, "You didn't drop the eye, did you?" My head just sank. I remove a lot of eyes with a lead off like that. Goddamn. This isn't 100% on point, but I think close enough and I think interesting. I'm now a head and neck surgeon. But during my trauma rotation as an intern, we had an extremely inebriated guy come in who'd been hit by a car just outside of the party he'd been at and suffered a traumatic amputation. The accident knocked his leg off at the knee. So he's wheeled into the trauma gurney on a bed. And his leg is brought into the same room literally in a bucket of ice. The guy was super combative, trying to push us around. And at one point literally yelled, "Duck off. Let me walk it off." By my calculations he would have made it one step, two tops. Made it one step, two hops. Or nurse here. Recently did a below the knee amputation. The leg was severed and I was passing it off to the circulating nurse for specimen. Went to take a clamp off a large artery and my poor co-worker got a big spray of blood. Felt terrible. Not related to amputation, cesarean section. But when I was a student midwife I managed to forget to attach the catheter bag to the tubing when catheterizing and I managed to get urine into the theater nurse's eye. I was not popular. I had to explain to the patient why we had to take bloods after the baby was born as part of the potential contamination protocol. She thought it was hilarious. There's an amputation that set the record for both the fastest amputation at the time and most deaths, still the record holder. The surgeon performed the surgery so fast he took off his assistant's fingers in the same cut. Both the patient and the assistant died of infections. A gentleman viewing the surgery died of fright whilst watching. A heart attack in modern day one would assume. Why did he try to do it so quickly? Without anesthetic, surgeons tried to minimize pain by speed and getting the patient sheet-faced on booze pre-operation. So the surgery had a 300% death rate, but technically speaking it was a success. When I was a child, my dad's favorite joke whenever I hurt myself and cried was to grab a meat cleaver from the kitchen, hide it behind his back, examine my injury closely, prodding the sore spots with his finger, and after 45 seconds of examination of the bruising say, "I'm sorry son. We're going to have to amputate your insert leg foot limb. Hun. Come hold him down while I chop please." And he'd whip out the cleaver and carefully line it up while 6-year-old me would scream and try and squirm free and run away. He'd then usually say when I hobbled away, "Oh, so it must not be that bad after all. Hun. Cancel that procedure." Turns out he can actually walk. One time he did this and I caught him in the stomach with a little kick and he let out a little "oh duck" and almost dropped the cleaver. So this reminded me of that. Thanks. Cool that, but kinda dangerous. Not a surgeon, but I work in a facility that helps with rehabilitation of amputees and getting them walking again. I watch a resident go to stop a door from closing with his stump and it was like the world slowed down. From the moment I saw him move his stump to stop it, to the point of impact I was screaming, "Oh duck, that's gonna hurt so bad." And it did. He looked at me and just cried. I pushed him back to his room in his wheelchair and he apologized profusely, saying that it's just instinct cause he had a leg there for so long. He ended up splitting the stitches back open and the infection that came after ended with him going from a mid-shin amputation to above the knee the next week. He was a great guy. He's walking and back to living his regular life again. Oh hell no. I'll never again complain about my instinct that made me catch a falling cactus. I'm not a surgeon, but I did rotate in surgery back in my med school days. My first day on surgery rotation I was assigned to the trauma team. This was at a level 1 trauma center in an inner city hospital in NY. It just happened that on my first day, all the residents were in a meeting, so when the trauma surgeon needed an assistant, she asked me to join her for an emergency above knee amputation of about infected leg, wet gangrene in a very poorly controlled diabetic. So my first day on surgery I'm in the OR holding this man's infected leg while the surgeon saws it off. After she's done, she literally squeezes out pus from the thigh. The odor was putrid. It's one of those smells that lingers for days. For the surgeon it was just another day. But for me it was definitely a no duck moment. Edit. Removed extra res from pus. Street. Barnabas in the Bronx. I rotated there about 10-12 years ago. Agreed with the surgeon above that our training is so long detailed that we don't have these moments frequently. However, in residency I was doing a hemipelvectomy, essentially a removal of half of a patient's pelvis with or without removal of that leg, with my attending surgeon, and we came to a crucial step. After a few hours of dissection and planning, we had made our cuts on the pelvis, basically planning and mapping out the portion we would remove. The time came for us to complete the cuts by levering out the half of the pelvis with our hands, which required a lot of force. After the levering, there was an audible crack, expected, but then the wound immediately filled with blood, unexpected. My training to that point told me to immediately pack the wound and hold pressure. My attending looked at me and said keep holding pressure, and then scrubbed out, took off his gown and gloves, and left the room. I'm now standing there over this young patient holding pressure with all my might so that my arms are shaking. I looked to anesthesia and his PA and asked what the hell was going on. Here I am single-handedly keeping this patient alive with no direction or immediate game plan about how to fix our problem. This was my ODUC moment. An eternity, it seemed, went by and my attending came back in. Scrubbed in. And we then methodically isolated the large bleeding vessels and tied them off, cauterize them. Afterwards I asked him what he was doing. He said over the years he had learned if he had a rise in anxiety from something unexpected, I guess his ODUC moments, he would take a breather, whether physically removing himself from the situation or not, to refocus and psyche himself up to fix the issue. This was one of my greatest learning moments of my career. That's kind of terrifying but also really reassuring. Surgeons mostly know what the hell they're doing. Taking a breather in those moments is so smart. Surgeon here. Have a few stories. 1. Called to the ED to evaluate a table saw injury to arm. Found a mid-forearm almost complete amputation hanging on by a skin bridge. We were able to reattach it and I think the patient has good muscle function but tenuous sensation back now. 2. My intern year. Got a consult for a cyclist who was blindsided by a pickup truck. Entire leg was completely mangled. He arrived intubated and sedated with lots of other injuries. Dude never woke up. It was the first time I saw a leg filleted open from trauma. With exposed femur, also fractured. And multi-level open tib fib fracture. Just hanging out of the tissue in the ED. We amputated the leg at the shin and then femur while trying to save him. He died of massive kidney failure from muscle injury. Dead muscle protein clogs the kidneys like taking a big dump clogs your toilet. Kidneys failed causing liver to fail, and then lungs fill with fluid means they can't ventilate. And cardiac issues follow from electrolyte abnormalities. No amount of existing technology can bring you back from that. Unfortunately. 3. One of my worst cases was a patient with really bad sepsis from an infection. All the blood vessels in your extremities constrict. So amputating fingers isn't all that common. But this was catastrophic, as we ultimately had to amputate all 4 limbs. I'll never forget writing that op report. You list each procedure for these documents. And it went. 1. Amputation left arm. 2. Amputation right arm. 3. Amputation left leg. 4. Amputation right leg. Patient was a Family Guy fan and said their Halloween costume would be the pirate the following year. At least they didn't lose their sense of humor. Cause that was ultimately some funny sheet. Surgeon here. We go through extensive training so those moments don't happen. The only time I've even had that thought on the OR is in reaction to how far a patient has let the disease process go before seeking treatment, usually an infection. I had an ingrown toenail that I let go far enough that 2 doctors actually yelled holy shit when they saw it. I now go to the doctor immediately when I need to. Bet you this is going to contain more not a surgeon but than actual surgeons reading this. You have won that bet. Technically, he contributed as well. Not a surgeon but I once took the legs off my sister's Barbie. I was about 8. That was a huge duck up. I couldn't put them back in. In a panic I took the arms off too, hoping that'd somehow help. It looked way worse. Had to hide the evidence in the bin. I've never told her what happened. The guilt is still there. I hear this is what real surgeons do as well. I was first assisting on a emergent guillotine ankle disarticulation. You basically just rip and cut the foot off from the leg and leave the bones sticking out. I was providing traction on the intensely infected foot while the surgeon sliced through the remaining tendons holding it in place. When the last one snapped, I fell back, holding on to the now independent foot, squeezing a load of green pus out onto my chest. Was just thankful it hit the gown and not my exposed neck. Why do you leave the bones out? P.S. When you said gown, I was picturing a very elegant dress. Not a surgeon, but used to work in a nursing home, and I was meeting a patient for the first time without reading their file. As I entered the room I said, "Wakey wakey, let's jump out of bed." And as I looked at him I said, "Let's kick those covers off." Once I removed the blanket and saw he had no legs, things got quiet quick. I've always told my patients to jump out of bed, no matter the state of their limbs. One guy with a straight face said, "I can't. Those bastards stole it." He lost a leg in WWII. I grinned and he hopped out of bed. He had a great sense of humor. Shoulda put a serious flare here, bud. This thread's gonna need a toe tag. I work in the quality department for a large hospital system. We had a doc take off the right foot instead of the left. That was a lot of fun paperwork, as well as a lawsuit. Wrong side surgeries are surprisingly more common than you'd think. Wrong side amputation, however, is thankfully more rare. That's crazy. When I had my ACL repaired, I had to verify to practically everyone who walked in the room which knee it was, and the surgeon and I think maybe even the anesthesiologist, both had to sign the correct leg in Sharpie before they would even do the spinal block. As a med student, I used a giggly saw to remove a dead leg from just above the knee from a man who was homeless and horribly diabetic. When it came off, the surgeon said, "Here," and handed it to me. Then he said, "Take a picture. It's your first one," like someone was gonna have me hold it like a fish I caught. He was joking, but I was freaked out and dropped it on the floor. Such a weird moment in my training. Nurse in an emergency department. Accidentally amputated a toe that was rotting in a boot when I pulled it off the patient's foot. There were many ducks said that evening. Does that count? We had to do a double leg amputation, but I just couldn't get them even. Long story short, now he's just a torso. Now the patient is half the man he used to be. I was a surgical tech in the early 1990s. We were doing an AKA on somebody with a gangrenous foot. We cut through the tissue and the giggly saw broke when we were 1/4 of the way through the femur. The hospital didn't have another. All of the ortho saws were in use. The doctor made me get the guy's leg under my arm, jump up in the air, come down with all my weight, and snap the femur at the point where we started sawing. It took 2-3 tries, but then snapped and splintered. We used a rasp to smooth the bone. I was left holding the gangrenous lower leg. It was big, so I tried to bend it at the knee to get it in the specimen bag. At which point, a bunch of blood squirted out of the leg and all over the face of the circulating nurse. Not my finest day. I was 18 and being paid minimum wage. Took 5 surgeries to amputate my left leg, BKA. 3 years later, wound still open. The worst part is the full left, all 3 bones protruding along with their nerves, so every step I take is like an electric shot. When I asked for some pain meds, he told me instead he would pray for me. Told him to stick his prayers up his ass. Walked out and never went back. Filed a complaint with the AMA and his license was suspended. F him. Not a surgeon. Nursing assistant. The surgeon was amputating above the knee. I noticed during the amputation that the patient's heart rate went up really high, which made me think he could have anesthesia awareness. This is a rare phenomenon when a patient is under anesthetic but can still sense what's happening around them, which can include feeling pain. I asked the surgeon if that was normal, and brought up anesthesia awareness, in between directing me and the other assistants. He explained that it was possible but that we couldn't stop the surgery over it. I found a break in the action and quickly leaned over to his ear to say, "I'm sorry." I never got to see him afterwards, so I'm still wondering if he heard me.